Hi, my name is Chris Sterling. I'm a community health nurse with Siksika Community Health. We are putting together a web series about COVID-19 or the coronavirus, where we'll discuss general information to help you understand what the virus is and things that you can do to help protect you and maybe answer some questions you might have about it. So in this first video, we're going to just discuss what COVID-19 is in general, what the disease is or what the virus is. So COVID-19 is a respiratory illness that attacks the lungs. It is the common symptoms of COVID-19. The most common ones you might have is fever or cough. Additionally, sometimes some people have levels, some fatigue at different levels. So it might be slight fatigue to severe fatigue. And in severe cases of COVID-19, you may have difficulty breathing. If you were to get infected with COVID-19, you don't get sick right away. It generally takes anywhere between 2 to 10 days, but potentially as long as 14 days for symptoms to start. So the way COVID-19 is spread is it's spread through droplets when an infected person coughs, sneezes, or talks. So those droplets, which are kind of like little beads of moisture or spit that comes out of your mouth, can travel about 2 meters through the air and land on different surfaces. So maybe land on your face, land on your clothing, or land on an area that you might touch. Okay? So if someone were to cough directly on you, that would be one way that you could get sick from it, if it gets in your nose, eyes, or mouth. The other way you could get it is by having personal contact with individuals who are sick with the virus. Because they're coughing all the time, you have to assume that their hands and their clothing are potentially contaminated with the virus. So if you were to touch those hands, touch that clothing, hug, or even kiss that person, you could get sick from the virus by transmitting to your eyes, nose, or mouth. Okay? And finally, like I said, the last one is it could be on a surface, a commonly touched surface. So if someone's sick, there's a good chance that they're touching common areas that you might be touching. And if their hands aren't clean, the virus can transfer from their hands to that surface and then onto your hands when you touch it. And if you were to touch your nose, eyes, or mouth, afterwards, then you could potentially be transmitting the virus into your system and getting yourself sick. Okay? One thing we are pretty sure about is that it's not an airborne virus. And what that means is that it doesn't linger in the air after a sick individual leaves the room. The only way it is in the air is when they're coughing and then the droplets fall to the ground. So if you were to breathe it in at that point, you could get sick, but afterwards, if they've left, it shouldn't be around in the air for you to get sick anymore. The only surfaces that would be a danger would be where those droplets might have landed. Okay? So that pretty much concludes what COVID-19 is and how it can get you sick. In the next video, we're going to talk about COVID-19 risk and how the severity and who's at greatest risk for having a severe version of the disease. We'll see you then.